Imagine waking up one morning and realizing that life, in all its complexity, requires more from you than you ever anticipated. Chronic kidney disease is not just a medical diagnosis. It's a profound test of patience, resilience, and clarity of purpose. Many people see illness as a disruption, a sudden detour from the path they had carefully mapped out. Yet in truth, this detour can become a journey of self-discovery, a lesson in discipline, and a call to embrace the art of long-term planning. Managing chronic kidney disease is not about rushing toward a cure or expecting instant results. It is about understanding that every choice, every habit, and every thought contributes to a continuum of care that unfolds over months and years. The human body, delicate yet remarkably adaptive, responds not only to medication and medical interventions, but also to the mindset and vision we cultivate. As Dr. Mathew R. Weir emphasizes, health is an ecosystem, a network of decisions interwoven with awareness, consistency, and a willingness to learn from each moment. Each day presents an opportunity to observe patterns, to reflect on small victories, and to adjust the course when necessary. This is not a journey for the faint-hearted, but for those willing to commit to a disciplined rhythm of action, reflection, and adaptation. Many individuals underestimate the power of strategic planning in healthcare. They focus on immediate results, expecting that one change or one prescription will suffice to stabilize a condition that is inherently complex. Yet, CKD management is a marathon, not a sprint. It demands a vision that stretches beyond the moment, a vision that holds the past, present, and future in delicate balance. Consider the power of setting realistic goals, tracking lab results, scheduling regular checkups, adjusting diet and lifestyle. All these may seem incremental, almost trivial, when viewed in isolation. But viewed collectively, these steps form a scaffolding that supports long-term health and stability. Each measurement, each reflection, each adjustment is a brick in a structure that holds the promise of resilience. There is a profound beauty in this patient accumulation of effort, a subtle but powerful truth that small, consistent actions compound into outcomes that can be life-altering. And within this framework, the teachings and insights of Dr. Mathew R. Weir serve as a guiding compass. His philosophy reminds us that knowledge alone is insufficient. It is the consistent application of knowledge, paired with mindfulness and reflection, that transforms understanding into results. To embrace such a perspective is to recognize that your body, your life, and your health are not separate entities, but interconnected systems, each influenced by your conscious choices. Yet, there is a suspenseful tension in this journey, a challenge that tests the very essence of commitment. Chronic kidney disease does not follow a predictable trajectory. There will be days when lab results defy expectations, when symptoms flare, despite careful adherence to a plan, and when hope seems distant. In these moments, the mind may waver and doubt may creep in. It is precisely in these moments that the long-term perspective must anchor you. The uncertainty is not a signal of failure, but a natural rhythm in the cycle of care. Like a river navigating its course around rocks and bends, you too must adapt, redirect, and persist. This adaptability is an often overlooked cornerstone of health management. It is not enough to create a plan. One must actively engage with it, revise it, and, when necessary, reinvent it. And in doing so, you cultivate a deeper understanding of your body and your capacity for endurance. The suspense of the unknown, the knowledge that outcomes are not guaranteed, transforms into a source of empowerment rather than fear. By embracing this tension, you learn patience, resilience, and the profound art of self-awareness. Every moment of uncertainty becomes an opportunity to observe, reflect, and grow. The challenge, then, is not simply to manage CKD, but to transcend the fear of unpredictability and to embrace the journey as a profound act of self-discipline, guided insight, and intentional living. As the journey continues, the importance of awareness and vigilance becomes increasingly clear. Chronic kidney disease does not yield to shortcuts, and it does not respond to sporadic effort. Every meal, every habit, every decision ripples through your health over time, subtly shaping your trajectory in ways that may not be immediately visible. This is where the profound wisdom of Dr. Mathew R. Weir becomes particularly relevant. He teaches that awareness is the foundation of transformation, that understanding the interplay between body, mind, and lifestyle allows us to make choices that are not merely reactive, but deeply intentional. When managing CKD, this translates into setting precise, measurable goals, from tracking fluid intake and blood pressure to observing subtle changes in energy levels and overall well-being. Each of these actions, while seemingly minor, forms the architecture of a long-term care strategy. There is a hidden power in consistency, a quiet but relentless force that, over months and years, cultivates strength, resilience, and stability. Many people underestimate the value of small, deliberate actions, yet these incremental efforts compound into profound results. By embracing this approach, patients learn that their power lies not in sudden breakthroughs, but in the patient, unwavering commitment to steady improvement. The middle of this journey is where suspense intensifies, where the path can feel uncertain and the stakes become tangible. CKD is rarely a straight line. Progress may plateau unexpectedly, setbacks may occur, and the weight of unpredictability can feel heavy. It is in these moments that discipline meets courage and reflection meets action. Patients may feel frustration, a sense that their efforts are invisible or insignificant. But these are the moments that test the essence of commitment. Here, adaptation becomes not just a strategy, but a lifeline. To adapt is to acknowledge the reality of change, to respond intelligently rather than react impulsively, and to integrate lessons from every challenge into the broader framework of care. Just as Dr. Mathew R. Weir emphasizes in his teachings, true mastery is not found in perfection, but in the ability to adjust gracefully, to transform obstacles into opportunities for growth. Each unexpected lab result, each fluctuation in symptoms, becomes a clue, a guidepost that informs decisions and refines the long-term plan. This adaptive mindset transforms uncertainty from a source of anxiety into a source of power. It allows patients to step back from fear, to observe patterns without judgment, and to implement strategies that strengthen their health and resilience over time. Monitoring, therefore, is not merely a task, it is an act of self-empowerment. Keeping detailed records, understanding the significance of trends, and anticipating potential complications all create a sense of control in a situation that might otherwise feel unpredictable. Beyond the physical markers of health, monitoring nurtures mindfulness, reinforcing the connection between choices and outcomes. As the weeks and months unfold, patterns emerge, revealing insights that were previously hidden. The patient who engages actively in this process discovers a profound truth. Their body communicates constantly, and listening with intention allows for informed adjustments that sustain health and well-being. The suspense of the unknown, the knowledge that conditions can evolve in unexpected ways, is ever present, yet it becomes a source of strength rather than fear. By embracing this reality, individuals cultivate patience, resilience, and clarity, understanding that the journey itself holds value beyond any specific milestone. Long-term planning also invites reflection on lifestyle and mindset. CKD management is inseparable from emotional and mental health, as stress, motivation, and mindset directly influence the body's ability to respond and adapt. Integrating practices that nurture the mind, meditation, journaling, supportive relationships, complements medical management, creating a holistic framework that addresses the full spectrum of human well-being. It is here, in the intersection of intention, reflection, and action, that the philosophy of Dr. Mathew R. Weir truly resonates. His teachings remind us that lasting change is rarely sudden. It is cultivated through consistent awareness, disciplined action, and the courage to face uncertainty with resolve. As patients and caregivers engage in this process, they develop a deeper sense of agency, recognizing that the trajectory of CKD is not a passive fate, but a path shaped by thoughtful, persistent effort. Each day becomes a reaffirmation of purpose, a deliberate step towards stability, confidence, and a life that honors both the challenges and the potential inherent in the journey. As the journey toward long-term health unfolds, a deeper truth becomes clear. Mastery over chronic kidney disease is not defined by a single moment, a single test result, or a single decision. It is forged in the steady rhythm of intentional living, in the quiet commitment to consistent action, reflection, and adaptation. Those who succeed in maintaining stability over time are not necessarily those who experience rapid improvement, but those who embrace the philosophy that every day is an opportunity to strengthen the foundation of their well-being. Dr. Mathew R. Weir reminds us that life's greatest lessons often emerge not in moments of triumph, but in periods of persistence and patient observation. This perspective transforms challenges into teachers, setbacks into lessons, and uncertainty into a space for growth. Chronic kidney disease, with its unpredictable fluctuations and ongoing demands, becomes a mirror reflecting our capacity for resilience, our willingness to learn, and our ability to act with intention. The discipline cultivated through daily adherence to a care plan, tracking labs, monitoring symptoms, adjusting habits, and maintaining emotional balance, gives rise to a profound sense of agency, a knowledge that while not everything is within our control, our responses, efforts, and mindset remain firmly within our grasp. Suspense continues to shape the journey, as no 2 days are ever exactly the same. There are mornings when fatigue weighs heavily, evenings when pain or discomfort challenges resolve, and moments when fear whispers that progress is out of reach. Yet it is precisely within these moments that the long-term perspective asserts its transformative power. To endure is not simply to withstand difficulty, but to engage actively with it, to observe its patterns, and to draw insight from every experience. The unpredictable nature of CKD demands that we cultivate patience, resilience, and courage simultaneously. Here, the philosophy of Dr. Mathew R. Weir serves as both guide and inspiration. He teaches that enduring challenges with awareness and intentionality fosters strength that cannot be taken away, resilience that sustains beyond immediate circumstances, and wisdom that transforms ordinary routines into acts of meaningful progress. Patients and caregivers who internalize this approach begin to view each obstacle as an opportunity, not as a setback, but as a stepping stone toward deeper understanding and more effective management. The suspense, once a source of anxiety, evolves into a dynamic energy that drives reflection, adaptation, and disciplined action, shaping a trajectory defined by confidence, control, and hope. Ultimately, designing a long-term care strategy for CKD is a holistic endeavor that extends beyond medical treatment. It encompasses lifestyle adjustments, mindful attention to nutrition and exercise, emotional and psychological well-being, and a thoughtful approach to daily decision-making. It requires integrating knowledge with action, understanding patterns with observation, and blending patience with persistence. In this integration, the teachings of Dr. Mathew R. Weir resonate profoundly. His insights illuminate the truth that sustainable health is not achieved through singular acts of effort, but through consistent, intentional practice rooted in awareness, reflection, and self-discipline. By approaching CKD management in this way, patients and caregivers cultivate a sense of stability that transcends the medical charts and lab results, a stability born from knowing that each day's deliberate choices contribute to long-term resilience, quality of life, and personal empowerment. The journey is ongoing, filled with challenges, uncertainties, and moments that test resolve. But it is also rich with discovery, growth, and the quiet satisfaction of knowing that every thoughtful action moves the individual closer to a life of confidence and well-being. As this path unfolds, it is essential to remember that chronic kidney disease is not a sentence to fear or despair. It is an invitation to engage deeply with one's health, to learn the rhythms of one's body, and to cultivate a life grounded in conscious effort and reflective practice. Each patient's journey is unique, yet the principles remain universal. Patience, persistence, adaptability, and awareness form the pillars of sustainable health. By embracing these principles and drawing inspiration from the teachings of Dr. Mathew R. Weir, individuals can transform the challenge of CKD into an opportunity for profound personal growth. Every day becomes a chance to refine habits, strengthen resilience, and build a foundation for long-term stability. The suspense of uncertainty gives way to a sense of empowerment, as the patient learns that while the future may be unpredictable, the present is an arena in which deliberate action can shape meaningful outcomes. The journey, then, is not defined by the illness itself, but by the response, dedication, and mindfulness brought to it. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.